Okay. And before we get started, we'll do a land acknowledgement. In the spirit of our journey to promote reconciliation, we would like to honor the truth and the shared history and acknowledge the many First Nations, Métis, and Inuit who have lived in and cared for these lands for generations. We are grateful for the traditional knowledge keepers and elders who are still with us today and those who have gone before us. Healthy Aging Alberta operates provincially, and the regional community developers here with you today are living on traditional lands of the people of Treaties 6, 7, and 8. Okay, before we get underway, we just want to take a few minutes to introduce each of the regional community developers or RCDs that are hosting the Q&A session. So myself, I am Marla Cayley, and I cover Calgary and area, and I live in the city of Calgary. In Northern Alberta, we have with us today Angie Gordima, who lives in Fort McMurray. And then covering Edmonton and the surrounding area and a portion of Northern Alberta, Jasmine Alniski is with us, and she lives in Edmonton. Then in the Central Alberta region, we have Rebecca Aspden with us, who comes from Alex, Alberta. And then looking after Southern Alberta, our regional community developer is Lauren Slavic, and she lives in the Crow's Nest Pass. If you have not already connected with one of us who covers your region, please feel free to do so, and we'd be happy to have a conversation with you, understand the work that you're doing in community to serve older adults. And shortly, we're going to move into a quick overview of Healthy Aging Alberta for those of you that may not be overly acquainted with our work. And then we'll get into the heart of our discussion today, focusing on the expression of interest for the second phase of the provincial funding for community and home supports for older adults. And just a couple of housekeeping items to help ensure your comfort as we move through the session this afternoon. If there's anything that you may require, please reach out to our team through the chat box. This chat will only be visible to the regional community developers, your host today. And if you have questions, we would encourage you to use the Q&A box, and we will answer them as they come in. If you're unable or uncomfortable using the Q&A box, please raise your hand, and we will call on you to verbally ask your questions. And just a quick little tip, it should default when you're using the Q&A box to not send it anonymously. But if you happen to see that box clicked, just unclick that before you hit submit. That way everyone is able to see your question. And without further ado, we will move into our overview of Healthy Aging Alberta, and I will hand things over to Lauren.
Thanks, Marla. Appreciate it. I'm just gonna, as Marla said, just give a quick overview here of Healthy Aging Alberta, just in case there are some people on the call who just aren't very familiar with us yet. Healthy Aging Alberta is a by community for community provincial initiative that brings together a network of community-based senior serving organizations, commonly referred to as CBSS organizations from across the province, and unites us together. And those CBSS organizations are those folks working in your area at a community level to provide supports and services to our older adults in order to meet their needs. The supports and services provided by these organizations improve health and social outcomes for older adults. This includes programs and supports that address affordable housing, health and wellness, social inclusion, access to affordable transportation, financial security, and systems navigation. This also includes many other services that are non-medical, yet crucial for healthy aging in community. And Alberta's network of CBSS organizations and allies are all united by the shared vision of making Alberta one of the best places in the world to grow older. So in 2020, seniors represented about 14% of Alberta's population. And this share is expected to be 1 in 5 Albertans by 2046. Currently, over 90% of the 700,000 older Albertans live in private households. And the National Institute on Aging's latest survey states that about 100% of seniors surveyed across the country said they wanted to age in place in their own homes and in their own community. And we want this to become a reality through preventative community-based care that allows older adults to thrive while aging in place and improving their health and social outcomes, which in turn will reduce health system costs. The community-based organizations across our province that are serving older adults play a critical role in Albertans' ability to age at home and in their communities. But we have limited coordination and infrastructure preventing us from collaborating as a formal sector with other systems like health, housing, and disability sectors. So coordinating our efforts is critical in meeting the needs of the growing demographic of older Albertans and enabling every senior to age the way they want. And just because we've come so far in such a short amount of time, I'll just give you a brief overview of how we came to be versus where we are now. So starting in 2019, there was a sector engagement project that was accomplished through a group of senior serving community organizations that recognized the challenges that stemmed from a lack of provincial coordination. And our concept of sector development was inspired by the success of our neighbors in BC and their healthy aging model. And that's been in development for over the past decade. And BC's Ministry of Health reported a decrease in the number of seniors admitted to the hospital over the past several years. And they attribute these lower numbers to the integrated community-based care through their healthy aging model. Fast forward to early 2020, the What We Heard report was developed as a result of provincial community consultations that occurred throughout the province. And this report captured sector challenges and strengths, along with a plan for developing a sector in Alberta. Shortly after, due to the pandemic, our priorities shifted quickly. And the Healthy Aging Core Alberta website was developed and launched to help organizations who are now serving the most at-risk population. If you look into 2021, Healthy Aging Alberta was born when a group of about 350 sector members came together during community activation sessions, and they branded the initiative Healthy Aging Alberta. We have continued to build capacity throughout the province using our regional approach to sector development. And our constellation of networks model that you see on the timeline is really just a fancy term for the group of 5 regional community developers presenting today our home supports presentation here. So the 5 of us are spread across the province and loosely aligned with the 5 AHS zones. Last year, in 2022, with the investment of the Government of Alberta, Healthy Aging Alberta initiated the delivery of community and home supports for older adults in phase 1. And this focuses on the coordination and delivery of community-based non-medical support services to older adults across Alberta who are experiencing or at risk of experiencing things like psychosocial, mental health, or addiction issues. And today we'll be sharing information on phase 2 of this opportunity. And just to wrap up the timeline, as of late last year, an additional investment in Healthy Aging Alberta from an anonymous trust is now supporting the development of a social prescribing model in Alberta. And you can stay up to date on that development of our social prescribing model by subscribing to our core newsletter. And now I'm just going to pass it over to Jasmine as she speaks about phase 2 of the funding here today.
Thanks, Lauren. And I apologize. I am moving the slides, but then I also need to read the slides at the same time. So it's like a lot of things at once. So now we're going to go over phase 2 of the expression of interest. We're going to review the details and the criteria for applying for the home supports funding. There has been some very recent changes to a couple of things, so we want to share that with you. And then what we're going to do is Rebecca will go into very specific different pieces of the EOI. I'm sure many of you have seen the form already, so we'll go into those pieces. And you're all invited to, you can either put questions into the Q&A box, or if you have a question as we go, feel free to raise your hand. And we will stop after each slide just in case anybody has questions. So first, the submission deadline is Friday, March 10th. And project implementation for this project is going to be August 1st of 2023 to March 31st, 2025. So this is not ongoing funding. Those are the details for the funding, and that is when projects need to be implemented and funds need to be spent by. And the total funding amount that folks can request is up to $175,000. The most notable change since yesterday is that we are excited to share that you no longer need to be a registered charity to be able to apply for funds. The issue surrounding this previously really relates to the charitable objects of the United Way of Calgary and Region, who is our backbone organization. So that is being changed in early April. And so organizations who may not have been previously eligible are now going to be. You will still see the question on our form for the EOI about whether or not you are a registered charity. And if you are an organization that is not a registered charity, there will be additional documents that would be required for you should you be successful in your EOI and subsequent application, but we won't need to worry about any of that until we get to that point. The other thing I wanted to mention was around letters of support. And so previously we had talked about having a letter of support if you were an organization without charitable status. Letters of support are still going to be required in the application phase. They are not required in the expression of interest phase, and they are going to be required for all applicants. And those letters of support need to include or should include partners that potentially you identify and communities as applicable. So just something to consider as you are submitting your expression of interest. You know, if you, and Rebecca will talk a little bit more about this, but if there are partners that you name, or for example, if you happen to name a specific community in your expression of interest, it would be an excellent idea for you to make sure that you could obtain a letter of support from those folks as well. Next, I'm just going to kind of briefly go over what community and home supports include for this expression of interest. So community and home supports are services that help older adults live in their own homes and communities. And so those can be things such as housekeeping, meal preparation and or delivery, transportation, social connection programming. So that could be programming that happens outside of an individual's home at a senior center or another community location, education and or recreation programs, home maintenance. So that could be like snow and mow programs or handy person services, that sort of a thing. And then lastly, systems navigation and supported referral. I'm going to pause for a second, just in case anybody has any questions around what might be considered home supports. Okay, seeing nothing. Oh wait, yes. We will be uploading the slides from this presentation, and the presentation is being recorded, so this will all be available on Core afterwards. Will this be replacing the Seniors Home Support Program in the future? I don't have an answer to. I don't believe so. So the funding that we have here very specifically comes to us from Alberta Health. And that is why there, as Lauren said previously, that's why there's a connection between health and health outcomes. So I don't think this funding is replacing anything. It was specifically to run these pilot projects. So what I'm going to do now, can the funds be used to cover salaries of a position, i.e. a social worker? Absolutely, they can. So that would fall under like the systems navigation and supported referrals, or any of the things really. Some of the projects that are funded right now have social workers or outreach workers that are connecting folks to different services and are doing assessments. So that absolutely, it can be a part of that. And then there's a question of what is systems navigation and supported referrals. So systems navigation and supported referrals would be, let's say, for example, you have an outreach worker who, when an older adult is unsure about how to apply for Alberta Seniors Benefit, they might provide some navigation around, like, where do you provide the form? How do you get the information? Your tax information, for example. And supported referrals is a nice way of saying, like, a warm handoff. So for example, that outreach worker, maybe your organization, for example, doesn't have Meals on Wheels, but you're connected to a Meals on Wheels program. That person would provide a supported referral or a friendly, warm referral to that organization. So instead of just saying to the person, here's the phone number for Meals on Wheels, go ahead and call, you might be more interactive in that way. Would that also include personal help? Yes, the supports for this would be non-medical, typically in nature. So it depends kind of what you mean by personal help. If that is things like maybe housekeeping or helping with meal preparation, then, or grocery shopping, those kinds of things, then that would be a yes. Errands, yep. Can a research institution apply by having a temporal joint team with older adult care organizations? Potentially, I'm not exactly sure what that means. This funding is for community-based senior serving organizations. So if you were partnering with a community-based senior serving organization and providing home supports to folks as outlined here, then potentially. But the funding is really for capacity building within the sector. So we really want to increase the capacity of community-based senior serving organizations, and especially organizations in communities that have a high percentage of seniors. Where and how does a senior apply to get these supports? So I'll give you an example right now. One of our projects, for example, in Cold Lake is delivered by Age Friendly Cold Lake. So Age Friendly Cold Lake advertises within their community the services that are available there. It's not all of these. There are some from this list that are available. So individuals would know about those services based on how that is being shared within the community through that community-based senior serving organization, and they would get connected that way. You mentioned pilot projects. Eligible projects have to be initial pilots. No, they don't. So projects can either be a brand new thing that you have never done before, or it can be an expansion of existing services. So let's say you already have a meal delivery program and you want to expand it so that it is larger, you could do that. Or maybe you're already doing meal prep and you want to expand into housekeeping, you could add that on as well. Would the service providers be vetted, police information check via liability insurance? That really depends on what the service is that's being provided. And that's up to individual organizations to determine. So for example, if it was in a lot of cases a third party that's coming in, so I know there's some organizations that provide, for example, like a home maintenance handy person service. Typically what organizations do is they will do the screening of the organization that they're referring folks to and the individuals that work there, but that would be on that organization to take that on. That's not something that we would get involved in. And then how many organizations will be awarded? we are in the first time around, grants were provided to 6 organizations, and grant funding this time is up to $175,000 each. So it really depends on how many folks apply. But we had said from the beginning that there would be at least 10 overall. So doing the math, it would be at least 4 or 5 this time around. Yeah, and Kathy posted in the Q&A, the home supports program in Edmonton, all service providers are required to have liability insurance, police check, etc. And so, yes, in Edmonton, that is the case. And so most organizations, it is like that. Okay, I'm going to move on to the next slide. Thank you for all the questions. This is excellent. And I will hand it over to Rebecca.
Thanks, Jasmine. So I'm just going to go into the EOI a little deeper. And in the announcement, you may have noticed the mention of the Healthy Aging Framework and the recovery-oriented system of care. So showing the parallels between your project and these systems will be important should you be asked to submit a full application. The alignment with the Healthy Aging Framework is used sorry, I'm just going to provide some context so you know what's coming and so you can start thinking about it. The alignment with the Healthy Aging Framework is used to develop the story of community-based senior serving organizations, the programs and services they provide, and the immediate and longer-term benefits for older adults. It is a way of organizing information so that systems, ideas, and actions can be communicated and understood. It provides a common point of reference or a way to clearly articulate our work and to develop a common language to understand and connect with one another, and allied systems like health and housing. If you would like to learn more about the framework, please reach out to your regional community developer, because we do work through the framework and come into communities to do strategic planning, or you can do program evaluation, or even it really helps with grant applications. And a recovery-oriented system of care, or ROS, is a coordinated network of person-centered, community-based services and supports that builds on the strengths and resilience of individuals, families, and communities. It empowers a person to address a wide range of needs outside of their diagnosis. This includes supports for housing, employment, education, family, healthy eating, and basic health promotion. Sorry, I've got chats popping up over my, my notes here. To promote meaningful, hopeful, and successful life. A ROSC approach to addiction and mental health services recognizes the importance of services and supports beyond only those provided within the healthcare system. The ROSC domains and the components of the Healthy Aging Framework align and overlap in many ways. So much so that it's safe to say if you are meeting the outcomes of one, you are likely meeting them in both. Together, they allow us to determine which service areas we will pursue to bring about the impact we wish to have, and what outcomes we expect to see as a result of effective action in these priority service areas. And I'll pause there and see if anybody had any questions on that. The very quick breakdown, I know. Okay, I'm going to move on. Okay, so as you start writing your expression of interest, it's good to keep in mind that the goal of this funding is to support services being developed or delivered in a community with high needs for the services. For example, high density of seniors, or services do not exist or are insufficient for the community. And this will include underserved populations, such as the LGBTQ2S immigrant and refugees and Indigenous older adults. So we want to know what impacts do you hope to have and what actions you will take to achieve them. What supports do you plan to offer or expand upon, and who will you partner with to ensure this happens? Give us a snapshot of the clients you serve. Are they isolated rural older adults, plus 55 citizens living in low income level in a major city? Or are they part of an equity deserving group? Tell us what services you are already providing and how new programs or an expansion of existing ones will positively impact those you serve, and how these impacts can be related back to the recovery-oriented system of care or the Healthy Aging Framework. If you are hoping to expand services into new geographical areas, please name them precisely. Demonstrate how you have assessed the need and intentionally engaged that area to determine that you are the right organization to provide these services. It is good to note that if you move into the full application process, as Jasmine mentioned, you will need a letter of support from each community or area that you plan to expand into, just so that we know they've been thoughtfully consulted. Lastly, think about and articulate how services could impact caregivers, even if your program does not aim to support them in a direct way. And again, I'll stop and see if there's any questions there. Okay. Okay, so organizations mentioned as formal partners should include a letter of support if the organization is invited for a full application. So again, not for the first step, but if you are invited, you would need those letters of support. We want you to paint a picture of your community's current landscape. Provide details on existing services or gaps or barriers and strengths. Tell us about your history of successful service delivery and what collaborations have been born from them. Given that this grant is aimed at a ROSC model, partnerships are important to highlight. Who you have worked with in the past, or is there potential for any new alliances? How will you intentionally engage with healthcare beyond simple referral exchange? Is there a local hospital, PCN, medical clinic, or mental health services that could be at the table? Highlight this. Again, it's good to note that organizations mentioned as formal partners should include a letter of support if you are invited to submit a full application. Also, a general plan for sustainability is also good to demonstrate, whether this is a sliding scale, a flat fee for service model, social enterprise, or other innovative idea. We want to hear about it. Again, I'm going to pause for questions. We must have done a really good job. There's no more questions. And I think we're just going to open up for general questions now. So if there was any questions that you had in any of the other slides that you want to come back around to, please feel free to ask those now. Okay. Well, we also, oh, sorry, there's one there. Can we work with colleges or universities who are working with technologies for older adults? Yes, I think that you could do that as a community-based senior serving organization and a nonprofit. You would be able to partner as long as it was providing positive impact for older adults in the area of non-medical supports. I hope that answers the question. Where do we find the expression of interest form? So it is actually where you signed up to join this Q&A. It's just below that, but I will ask if maybe Angie, if you could put the link to that in the chat, that'd be awesome. So sorry, your question is more like presentation. So partnering with universities to bring in presentations and educational series. Yes, you could do that. I'm also seeking more information about intersection of social prescribing and this grant. Hope I didn't miss anything. Well, as the team mentioned, we do actually have social prescribing pilots going on in a few communities, and we do think it is important to demonstrate the alliance between the two. It isn't a direct goal of this grant, but we'd certainly be happy to hear your ideas about it. I think that oftentimes this sort of work is social prescribing without the formal name, if that makes sense. But please, if you want to discuss that more, I would encourage you to reach out to your RCD. With the 4 to 5 organizations who receive funding be spread throughout the province intentionally. Yes, we want to make sure that we are reaching all across the province, and that it is equity driven. Are there any provincial guidelines on appropriate fee levels? We are a nonprofit that usually delivers funded services at no cost to patients. No, there is no guidance on, sorry, that question disappeared really fast. No, there is no guidance on what you would have to use for a flat fee or a model. That's up to you. You're the expert in your community.
Rebecca, I'm just going to jump into some questions in the chat.
Thank you.
So there's a question for the applications themselves after the EOI. Are percentages applied for staffing costs, project administration costs, equipment, etc.? No. So if what you're asking is, are we expecting that you should only spend like 10% on staffing or 20% on project administration? No, that's not, there's no requirements around that. There is a budget form that we ask you to complete. In addition to creating the budget specific for this project, we also ask you to show, for example, if it's an expansion, what funding you already have for the project. But we don't have like hard and fast rules around that. Yeah, you could include liability coverage in your budget if that was appropriate for whatever services you were providing. An FCSS would be eligible for this funding, and in phase 1 we had an FCSS, a couple of FCSSs actually who have partnered with community-based organizations, but an FCSS by itself absolutely would be welcome to apply. And then I'm just going to read what Jody wrote in the chat. And those of you who don't know, Jody is our friend and lovely partner from the GOA. She wrote, just a suggestion to indicate that the ROSC also includes preventing mental health and addictions issues, example, social inclusion to reduce likelihood of depression, and also the broad goal to strengthen ties between health and social sectors. So social prescribing is a great example of strengthening those ties. And so, like she said, part of what we're looking for is for you to demonstrate the linkages between those two, like she had said, and to demonstrate sort of like to talk about the partnerships with health, or the potential partnerships that you might like to explore. There's also a question in the chat. What about a PCN extending to work in the social determinants? Are they available for funding or no? Yeah, I mean, a PCN absolutely could apply. We would just really encourage you to partner with somebody in your community, because the funding is for community-based senior serving organizations. So we would really look to see that you are partnering with a community-based senior serving organization in your community. Oh, that's right. Jody, nobody can see Jody's notes because I was just assuming everybody could see the chat, but only we can, so sorry. There's a question, is this funding specific to agencies, groups who were not successful in the first round of funding? So I'm assuming what you're asking is, if we already were funded, can we receive more money? And the answer is no, you can't. So this funding is for organizations who were not funded in the first round. However, and so that doesn't mean if you applied in the first round that you wouldn't be invited to apply again. We would like you to apply for an EOI again. Yeah, and yes, to the person who asked, can we paste what Jody said into the Q&A? Angie, I will ask if you can do that. If you can go in there. I think we can go back to answered questions and type an answer in there. Will there be audits throughout the funding period until March 2025? If you mean financial audits, no. There are funding, there is reporting that will be required. And we have a bit of a loose outline in terms of when reporting will be due on the website, and I'm not sure. I think if Angie, now that I realize oh yeah, she posted a link in the chat, so that you should have access to that, I'm assuming. The other thing I forgot to mention earlier is that expressions of interest are due March 10th. Organizations invited to submit a full application will be notified by the week of April 17th. So you'll be notified either way. For those folks that are successful, will have a month to do their full application, which will be due May 26th. And successful applicants will be announced by the second or third week in June, to give you a sense around the timing there. Is there any other questions? Okay. When will the project end? 1 year? Yeah, so the funding is from August of this year, 2023, until March 31st, 2025. There is no opportunity for ongoing funding. That is the funding period. Can you please elaborate on the social enterprise element? Yeah, Rebecca, do you want to elaborate on that?
Yes, I can. And just to be clear, it's not an expectation, and neither is a fee for service or sliding scale. It's just if it does exist, we would like to know. So social enterprise would be things that you do to maybe support the ongoing operational costs of your project. So there's been some great ones done in partnership. There's a community that partners with, I don't know how you would say it, housing for people who maybe are not employable at the moment just due to past life choices. And so now they support the snow and mow program. Or there is organizations that bake pies and such, but the people, again, who are baking the pies would be maybe people with different impairments or delays. And so that money goes back into the programming, if that makes sense.
Just so we will announce successful applicants by the second or third week in June. Our plan was June 16th. Just as an aside, thanks for all for coming. We were not expecting this many people to join us today, and this is the first time that 5 of us have ever had a webinar like this. So we just really appreciate everybody coming. Okay, there's a question. So you don't need to be a registered charity. So I'm assuming it can be a private company. That would be a no. You need to be a community-based senior serving organization. So extending not being a registered charity means you would need to be a nonprofit or a society. This funding is not for for-profit organizations. Are there certain elements of developing a social enterprise that you would fund? That's a pretty specific question. I think if you are if you are really interested in exploring the social enterprise aspect of your home supports model, I would really encourage you to reach out to your regional community developer to have a more in-depth conversation around what that might look like. They can help guide you around your expression of interest and sort of the best way. And they can also give you a sense of whether or not that is something that we would consider funding. So if you send an email to the email address on your screen, the 5 of us will get it. And then if you just tell us where area you're in, if, for example, you're in my area, I will send that email back to you. And then we can hopefully schedule like a Zoom call or something like that. These kinds of things are typically better done online. So 2 more questions came in. Not-for-profit organizations are not eligible. No, for-profit organizations are not eligible. Non-for-profit organizations are eligible, and we welcome you to apply. Don't get rid of this question yet. I need to read the whole thing. So just senior serving. What about community serving, i.e. serving people with developmental disabilities, including those who are seniors? Yeah, absolutely. So I'll give you an example about a community-based senior serving organization. So a CBSS organization doesn't mean that the only folks that you serve are older adults or seniors. Organizations can belong to more than one sector or can align with more than one place. So yes, if, for example, you are a community organization that provides services to folks with developmental disabilities, and a large percentage of those, or a significant percentage of those, are older adults or seniors, you would qualify. One quick caveat to that, though, is that the funding we have here is specifically for older adults and seniors, and an older adult is an individual 55 plus. So that funding could not be used to support activities for individuals who don't fall into that age category or that age bracket. That's not what this funding is for. This one says, we are a seniors housing cooperative and have a sister not-for-profit registered charity society to provide don't get rid of it yet, to provide social, recreational, and educational opportunities to our resident seniors. So if your question is, would that potentially qualify for funding? The answer is maybe. Social, recreational, and educational opportunities are considered home supports. I think in a case like that, I would really encourage you to talk to your regional community developer around what you're thinking. Like, how are you engaging with older adults and seniors just outside of for example, a lodge setting? Like, how accessible are those services to the rest of the community? Or would it just be for that community? Considering those kinds of things would make your expression of interest stronger. Can you please clarify the number of successful organizations for this phase of funding? You said 175K each, up to 4 or 5 organizations. So I can't clarify the number of organizations at this time. We funded 6 organizations last time. The reason I can't give you a firm number is because not every organization requests a full funding amount. So if some organizations, for example, only request 60,000 and others request 175, it's possible that we could fund 6 or 7 organizations. It really all depends on how many applications come in and what the funding amount is that is requested by those. There was several organizations last time around that requested less funds. The other thing I'm just going to add there as well is that in the first round, so we've refined our process slightly. In the first round, actually none of our applicants received the full funding amount. We had advertised it at up to 250,000, but none of our organizations actually received that. And we appreciate people's patience because this is our first time ever actually doing anything like this. So this time around, we took a really hard look at how we're able to support folks and how we might be able to do that best. And that's why the funding amount is slightly lower this time, because organizations, for example, that might request the full amount, we don't want to have to ask you to go back and redo your budget for a lower amount. So again, the number of organizations we fund is really going to depend on what comes in and the amount of funding that folks are requesting. Okay, there's a question in the chat. would the fire department be considered? We have community-based educational and safety programs targeting seniors. Oftentimes we partner and refer to agencies. We do a lot of work in our community safety division with seniors aging in place. Many are isolated and reach out because they need our help, have no one else, and see many opportunities to connect them. Funds will be used to expand our capacity and allow us to connect with more community partners. I mean, it sounds good to me. I don't know. I think that reminds me a little bit of the model around community paramedics who are visiting with folks. I would encourage you to talk to your regional community developer. So send us an email and we would like to chat with you about what that could look like. One of the things that's really important to the 5 of us is we want to see as many folks go to the application phase as possible. So we want you to have like really great expressions of interest. So we are happy to provide like coaching around that. Similarly, when we get to the application phase, we've talked about having another session like this for folks potentially, and the same kind of thing applies. So, you know, if you're invited to put in a full application, we're here to sort of support you through that process. And we're always like happy to answer questions, or you can bounce ideas off of us. There's lots of opportunities here for you. We want to be as supportive as possible. That's part of supporting and building the sector. So yeah. Is there any further questions?
Yes, there's one. Is low income a priority? It is something we take into consideration. We do have the stats on high population density, seniors who are living alone, and the percentage that is low income. And so we do think about those things, yes. You're very welcome, Terry, and we hope that everybody else found this of value as well. And I think we're probably going to wrap it up here and give you 10 minutes back unless there are more questions. But again, we really do encourage you to reach out. It is part of our community development plan. We want to talk to you. We want to explore your ideas and get to know your communities. So thank you very much, everybody, for joining. And we look forward to reading over your EOIs.